Hello everyone, my name is Grace Rowe. Thank you so much for joining us for another information video about COVID-19. In this video, we are going to discuss mental health and well-being. Research has highlighted that almost 1 in 2 children and young people in New South Wales report feeling stressed and are concerned about the impact that social isolation is having on their mental health and well-being. This is a really confusing and isolating time for all of us. We have never been in a situation like this before, so it is an important time to ensure that we are taking care of our well-being. But also, as we move through this time, go back to school, work, and begin to see our friends again, there may still be moments where we feel flat or confused. For this video, I am joined by Professor Rachel Skinner, who is the Senior Clinical Advisor in Youth Health and Wellbeing for New South Wales Ministry of Health. During this interview, we will be observing social distancing rules as recommended by the New South Wales Government. This video, along with other COVID-19 related videos, are available to watch on digitallunchbreak.newsouthwales.gov.au. Thank you, Professor Skinner, for joining us today for this video. So firstly, Professor Skinner, young people have been experiencing prolonged social isolation. This is a new experience for everyone, and many people even have mixed feelings about it. Would you be able to explain how this situation will be impacting and influencing children and young people's mental health and well-being?
Well, it's interesting because it's an experience like most of us have never gone through, and certainly for children and young people it would be the first sort of experience where their lives have just been upended, really, and so their normal routines have completely changed. And there's a lot of talk about the virus and the potential risks, and so that impacts on children's and young people's health and well-being. It's quite normal for anybody to feel anxious and distressed, sad, or angry even during this time. So certainly for young people, we would expect that they would also feel the same. So it's interesting because we've just found from recent surveys of young people over the time of the COVID pandemic that does show that they are quite concerned about the virus and the pandemic, and particularly about family members or loved ones catching the virus, and even themselves catching the virus, particularly if they're frontline workers. They're concerned about how the pandemic might impact on their jobs. We've heard a lot about job loss. That can impact more on young people than other age groups, and that's what we've heard. They're worried about the impact that it has on their school and what that might mean for them longer term. And they also, of course, worrying about not being able to keep up with their friends in the same way, having to do it all online. And then some young people are worried about whether they can access healthcare in the same way as they would have done before the pandemic, and also mental health care. I think considering all of this together, I think that we do need to take note of the way that young people are feeling and how they're faring, how they're travelling, and we should really look out for young people and make sure that we're doing the most that we can to support them.
So secondly, some people are reporting that they feel more tired despite doing less physical activity than usual. Is this related to mental health?
Well, it might seem counterintuitive that if you do less exercise, you feel more tired, but in fact we already knew that. I mean, the more exercise that you do, the more energy you have actually. But then coming back to your question about mental health, it is an important symptom actually of low mood and anxiety. So there are lots of reasons that could be contributing to low mood and anxiety, but we do need to take notice of the fact that a lot of young people are feeling tired because they have a lot of reasons to feel tired.
So what are some things that you recommend we could do to maintain a positive state of mental health whilst in lockdown?
Well, I think young people should think about what are the factors that are affecting their mood out of all of the different things that I've talked about. It's important that young people are well informed about the coronavirus and how to protect themselves and their loved ones. I think that if they are well informed, that gives them a sense of control over the situation, and having a sense of control is one step towards feeling better about the situation. So I recommend that young people access information from reputable sources, and what I mean by that is the New South Wales Government website on COVID-19. They can find out all of the latest advice and where we're up to in our fight against the pandemic, or reliable news outlets like the ABC, for example, and not spend a lot of time looking at social media, reading stories, and watching videos of very extreme and sad cases, because a lot of it may not be accurate, but also news does tend to exaggerate the worst cases. So if we're constantly seeing that, that can be overwhelming. So I'd recommend taking a break from that. Keeping a routine. So young people, they are used to going to school, having lots of activities. Their lives are very structured generally, and so for the last 6 weeks or so they have not had that structure at all. And routine is really important for mental health. So there are a couple of things that I'd recommend against. I think if possible to limit the time on screens. So when young people want to have a break, have some leisure time, rather than just going online, again, after hours in front of the screen, go outside. Sunlight is really good for mental health, so do some exercise with appropriate social distancing, perhaps with a pet. Consider doing other things perhaps that they haven't done before, like cooking, and learning other hobbies. And then rather than reading for pleasure online, reading a book. And of course, I would always recommend against alcohol and drugs, because that can have an impact on mental health. We also talk a bit about self-care for young people, and what that means is thinking about the things that you know make you feel comfortable and safe and relaxed. So that might mean staying connected with people that you trust, making sure that you can keep up those connections, and that might include connections with a trusted adult. But also when emotions feel very strong, there are techniques that you can use to help with those emotions. So relaxation strategies and mindfulness can help with calming us down, and also removing worrying thoughts from our minds. Headspace online has, and also the Headspace app has, can teach young people how to practice mindfulness, because it is a technique that you have to practice for it to work well. But we generally recommend that as something that young people can just do to keep on top of their emotions. I recommend that young people look out for this infographic that was designed by young people who provide advice to one of our local health districts. It has some nice suggestions, simple suggestions and advice. It's available on the New South Wales Health COVID-19 website.
Is it normal for young people and children to feel worried or anxious about catching COVID-19, or also worried about their loved ones falling ill with this virus? And how do we manage that? How do we do that well?
It's completely normal to feel anxious about catching the virus, and especially about perhaps older relatives catching the virus and getting quite unwell. And I think that earlier on in the pandemic that we really didn't have an idea about how things were going to pan out, how things were going to end up, because we were seeing high rates of infections and infection rates going up, and we didn't really know whether or not the strategies that were put in place some 6 weeks ago or more, whether they would actually work. But now that time has gone on, it's really reassuring to see that the things that we are doing has made a big difference. A lot of anxiety was generally in the community early on in the pandemic, and now we can see that the strategies that we've put in place do work, and that really should be reassuring to young people. Look at the information on the New South Wales Health COVID-19 website, because you can see there the rates of infection and how they've come down. And so as restrictions ease, so that we can get out and do more things, we do know what we can do that will be effective at protecting ourselves against infection. I mean, we know that now, so that knowledge is very reassuring.
Some people report not being able to sleep well or even having distressing dreams. Is this normal, and why would that be happening?
It's not surprising, and it's most likely because of this constant focus on COVID-19 that we've had since the start of the pandemic, so that all of the media, social media, all of the outlets that young people look at are filled with stories of terrible outcomes, terrible extreme events, and really tragic stories. And I think that the vivid dreams and disturbed sleep is probably related to looking and reading constantly these stories.
So what are some things that we could do to improve our sleep at the moment?
Well, there are some well-established strategies that young people can use to improve their sleep, and we call it sleep hygiene. And sleep hygiene starts with a regular daytime routine. So making sure that our day has exercise, work, regular meals and relaxation at regular times. But the other key aspects to sleep hygiene are to get up and out of bed at the same time every morning, to put the alarm on at the same time as you would get up to go to school or university on a regular day, and go to bed at the same time as you would on any other day. So not altering that, and then a routine of winding down before going to bed, so making sure that all screens are turned off, because screens can wake you up or keep you hyper alert. So we recommend turning off all screens, that is phones, television, computers, 30 minutes at least before going to bed. And then having some sort of wind down activity before going to bed that you do regularly, like having a bath, for example. And then, if sleep is difficult, not to worry about it, but not to lie in bed for hours awake. If you can't sleep, to get out of bed, go into another room, read a book. Don't turn on a device. Just read a book until you start to feel sleepy again, and then go back to bed. And then generally, no napping during the day, so only sleeping during those times, and of course no stimulants 4 hours before going to bed, so late in the afternoon or evening, not to have coffee or tea or alcohol.
The knock-on effects of COVID-19 can feel quite overwhelming. Maybe children and young people are concerned about loved ones falling ill, or just all of this change would have an impact. What are some strategies that we can use to overcome this overwhelming feeling?
It isn't surprising that they do feel like that, given this huge disruption that they've had to their lives, not working, not going to school, not able to study face-to-face at university. So, and also all of the other things that I've talked about. I think that in general, after trying out all of those simple strategies that I talked about the routine and relaxation, etc., and sleep, if young people still feel overwhelmed, it's okay, because this is a situation where a lot of people feel the same, and it's difficult, especially because young people may feel like they don't have any control over the situation. I would recommend that young people reach out for help after simple strategies are not, working. That might mean just reaching out to someone that they trust, a friend, but also a trusted adult, and talking through the way that they feel. There are other resources as well that they can access, of course. So there are quite a few online mental health resources that they can access. And then there are services for young people that are always open, actually. So the youth health services in many areas are still open. And so when young people really do need help, they can access it face to face. So I do recommend young people reach out when they feel that simple strategies are not working for them.
So, Professor Skinner, when do we know when we need to reach out for help, and when is the right time to do that?
From the surveys, we saw that quite a lot of young people reported feeling bored and tired and lacking in motivation. And I think those are, those sorts of feelings, if they go on for a long time, if they don't resolve with simple strategies, that's an indication that young people need to reach out for help. Other more sort of serious emotions like anxiety or feeling panicky, feeling like you don't want to reach out to friends like you would ordinarily do, they're more concerning. And if you're worried about your weight or you're feeling like you've lost confidence, there are also reasons to reach out for help. They're more concerning feelings. And then worrying about the future, feeling worthless or thoughts of self-harm are very concerning, and I'd recommend that young people reach out for help if they have any of those thoughts.
If we are worried that someone close to us is not coping well and is finding this time especially difficult, what can we do to help them, and when should we reach out for further help?
I think that if you notice that a friend has changed a bit in the way that they're interacting with you, if they're becoming less responsive, if they're withdrawing a bit from chatting and keeping in contact, if they're not doing their schoolwork or they're not doing things that they would ordinarily enjoy doing, if they seem to have lost their interests, that's a concern. If you're aware that they are eating more or less, and if they're not sleeping well, then perhaps what you could do is see if you could reach out to them and just ask them how they're feeling, and even make some suggestions along the lines of some of the things that we've talked about today, but also maybe suggesting that they make contact with a counsellor or somebody that they know and trust to have a talk about their feelings. If that young person doesn't follow through with that, then and you're still worried because they're continuing to be distressed or showing worrying signs related to their mental health, then it probably is important that you also tell a trusted adult about your concerns about your friend.
And lastly, Professor Skinner, where should young people go to get that further help during this time?
Luckily, there are some really good online resources for young people to help with their mental health and general coping. So we recommend Beyond Blue. They have online resources, and they have also a facility for interaction with and advice, either through a web chat or telehealth. There's also Reach Out and Headspace. Young people will be very familiar with Headspace, but they are not at the moment providing face-to-face services, but they do have an online and telehealth facility so that young people can still speak to somebody. There are youth health services in many areas, and they're still open. And of course, general practitioners are still open. If a crisis occurs, I recommend that young people call Kids Helpline or Lifeline. That's very important. And then, of course, there are other crisis services such as New South Wales Domestic Violence Line as well.
Well, thank you so much, Professor Skinner, for joining us today and for answering our questions.
It was a pleasure. You're very welcome.
Remember that during this pandemic, it is important to listen to advice from reputable sources. If you would like more information about the virus, please visit the New South Wales Government website by searching New South Wales Government COVID-19. If you feel unwell, it is important to tell someone and speak to Health Direct or a registered GP for advice. It is normal to feel anxious or upset by COVID-19. If you are concerned about your health and well-being and would like to talk to someone who can help you through these uncertain times, please contact one of the organisations on the screen who can offer free counselling and advice. There are also lots of links to resources that may help you on the New South Wales Government's Digital Lunch Break website. Thank you for watching. Lots of information in this video will help children and young people take care of their mental health and well-being both now and in the future. Thank you again to Professor Skinner for taking the time to answer these questions.